Hello, my name is Betty, and I'll be talking about the initiator role in clinical document exchange. Your practice needs to be set up with the responder role before you can have the initiator role enabled, and the initiator role is a little bit more complex. We'll cover how to set up users with permissions to query organizations for clinical documents, how to add organizations that will be queried by default, and then we'll talk about how to find, retrieve, and reconcile clinical documents from other organizations within the care quality network. The first thing we're going to cover is the user configuration piece. Once your practice has gone live with clinical document exchange, you will be able to see the user settings that I'll be talking about. Not everyone can retrieve clinical documents from the care quality network. You need to give each individual user permission. And this is not set up in user roles. This is actually set in the user account, which you can get to under the tools menu in user administration. So you'll select the name of the user that you wish to enable and click edit. And then on the account information tab, if you scroll to the bottom, you'll see a setting for clinical document exchange. And you'll want to check the box next to this user is allowed to query for clinical documents. You'll also want to select the role of that user at the practice. This identifies the person at the practice and their role when they query for documents. And queries can be made for medical treatment purposes only. The second part is the configuration of the default organizations to query. So hospitals and other practices that are part of care quality that your practice wants to reach out to and check to see if there are patient documents. So in the configuration menu, you'll select clinical document exchange, and this is where you can add the organizations that you want to query by default. So every time you go into a patient chart, the organizations you select here will be queried for clinical documents. There's a search dialog at the bottom of this window where you can type in the name of the organization you want to query. If it's part of the care quality network, it will show up when you enter the name. And again, any organizations you add here will be queried anytime you go into any patient chart. So we've decided that we're going to add the organization PCC Pediatric Test Associates Scone. And every time we go into patient chart, it will query this particular organization for patient documents. So the next piece we're going to talk about is finding, viewing, and reconciling the documents. We'll go through a couple of different scenarios: retrieving a single document for a patient, retrieving multiple documents for a patient, and also what happens when there are multiple patient matches found. So first you'll want to open up the patient's chart, and here we have Judy Jetson. We'll want to click on the History tab. And then we'll click on Find Clinical Documents. This will only be visible once the practice goes live with CDE if the PCC EHR user has access to query for clinical documents. And it looks like the system has already found records for Judy Jetson at one of the default organizations that we set up to query. So Judy Jetson has documents, it looks like, at Scone. So we'll go ahead and select Judy by clicking in the checkbox next to her name, and then click Find Documents to search for documents for Judy. So when we search, we find that there is one summary of episode note, and we can click the Retrieve button to retrieve that note. The system will give us the document date and the last retrieve date for that document as well. And from here, we can view it or reconcile it. So we decide we're going to view it. And from this view, I can see a human readable and printable version of the document with multiple pages. In the upper right corner, you see the default title. the category and the source of the document. By default, these documents are saved in the Retrieved Documents category. And from here, I can also reconcile the document. So you can either reconcile from the document right after it's retrieved, or you can view it first and then reconcile it. So we click Reconcile, and then we see all the information that we can import. You can see there's an allergy that came over, and we can select that to bring it over into the patient's chart in the EHR. And then before it will actually save the data, you get a confirmation screen to confirm all of the information before saving it to the patient chart. So now you have both the document that came over plus any discrete data like that allergy information that you reconciled into the patient chart. So now we'll talk about what happens when there's more than one document found for the patient. So here we have Sean Lancaster, and we're going to find clinical documents for this patient. And we see that information is available for Sean at the default practice, PCC Pediatric Test Associates, Scone. So we click Find Documents. And in this case, we find 2 documents for Sean. We can retrieve all of them. And once they are retrieved, we can go ahead and view and reconcile these documents individually. All right, in some cases, more than one patient can be found when you query for documents. So in this particular example, we are going to look for documents for Aaron Zeller. And we see that multiple patients were found with the same, almost the same name and date of birth. So there are 2 entries for Aaron Marie Zeller with the same name and date of birth at PCC Pediatric Test Associates, Scone. The only difference in the 2 is the spelling in the middle name and the patient's address. So it could be that the same patient with old demographic data and a typo is in the name. We're not sure. We can go back to patient match to see which patient matches the demographics that we have in our EHR and verify which patient we want to use. We could retrieve the documents for both of these patients if we decided to do that. So we've compared the demographics that we see in PCC EHR for this patient, and we're just going to select one of the 2. Right. So next we're going to talk about adding an organization to query for a single patient. What happens when the patient isn't found, and also how the retrieved documents look in portal messages and documents. Okay, so here we have T. Joshua Nakamura, and the system has found this patient on PCC Pediatric Test Associates, Scone. And we want to add another organization to this query. So we click on this little triangle, and it pops down another window, another dialog box where we can add another organization to this list. We are going to add PCC's Pediatric Test Associates Cake to this list, and then click Find Patient. So when we do that, the expanded triangle closes back up again, and we see both Scone and Cake listed here. And it looks like there are documents on Scone for this patient, but not on the organization we just added. So the next time you come into T. Joshua's chart, you won't have to add the second organization every time. Now that you've added it once, the system will query both of these organizations the next time you open his chart. All right. Now we're going to talk about adding the retrieved document to a portal message. So here we're viewing T. Joshua's retrieved document, and in addition to reconciling this document, we see an option to add to portal message. We can add a note in the message field and go ahead and send it to T. Joshua's parent. And then the parent can go into T. Joshua's chart through the portal and see that there's a message. There's a summary of care from the Scone office. And they can open the attachment here. These documents are not automatically available in the portal. The practice selects what is shared through the patient portal. As I mentioned earlier, the default category for these retrieved documents is retrieved documents. But you can change this. You can select a different category. If you want to file it to display on the visit history index and give it a document date, you can do that as well. And this is what it looks like in your visit history with the title summary of episode note attached this way. So next we'll talk about what happens when you have a user that doesn't have access to query. So even though a user does not have access to retrieve documents, they can still see the documents that were retrieved by someone else by going into the Documents tab. So you'll see there's no Find Clinical Documents button here because this user is not set up with permission for that. But if we go into Documents, we can see the retrieved documents. The clinical document is there. So then the user can go ahead and view, print, or add this document to a portal message. So even though some of your users may not be set up to retrieve clinical documents, they can still see the documents that were retrieved by another user. Another way that users can retrieve documents if they aren't set up with permissions is using an emergency access option. So this user does not have ability to retrieve clinical documents, as you can see. But if they go under the File menu and select Emergency Access, this will give the user access to additional functionality that they wouldn't normally have. Using this mode, Emergency Access also generates extra logging in PCC EHR. So they will select Emergency Access and then confirm that they do want to enter Emergency Access mode. And there's a visual indication that the user is in emergency access mode because there's a red bar at across the bottom of the EHR screen. So because this user was in the patient chart when they enabled emergency access, they will need to exit out of the chart and then go back in order to have the retrieve documents button show up. So we're going to exit out of T. Joshua's chart. And now you can see that the Find Clinical Documents button is available. And they can query for clinical documents in the emergency access mode. So we covered user access, adding default organizations, finding the patients and viewing and reconciling documents that we retrieve, how to retrieve multiple documents, how to handle multiple patients. And I just want to note that you don't have to retrieve every document that is made available to you. If more than one patient is found, you can download both of the versions of that patient or just one of them. And we also talked about how to add organizations for just one patient to query, how to view retrieved documents without querying, how to send those documents through the patient portal, and also how to query for documents with emergency access. And that wraps up our training on the initiator role.